Hi, my name is Dr. Rob Sheely. I'm a chiropractor in Middletown, Ohio. And I just wanted to talk with you a little bit about some things that happened today. I had a couple of new patients late this evening. And I, I love to take care of a new patient because half the time they've never been to a chiropractic physician before. They don't really know what we do, or maybe they think they do. And we do the consult. We do an exam, which includes orthopedic checks, neurological checks, postural checks, spinal balance checks, and of course all the vitals and everything. We get pretty detailed in what we do. And invariably, the patient will indicate that they've never been examined that way before. I know that the way that sometimes a patient is treated is as to they get to say their symptom, and the doctor writes some things down, and then they go do some tests, and so it's not this, so then we're going to go and take this medication, or we're going to do some physical therapy, and the patient doesn't actually get to spend much time with the doc. My initial exam usually is 15, 20 minutes or so. But it oftentimes leads to longer because we find out some things about them, and I try to educate the patient. I had one particular patient tonight that has had a problem for quite some time. He's just really not gotten the success. His particular problem was, like many people, things are out of balance in the spine. As a chiropractic doctor, it has been traditionally called a vertebral subluxation. Now, there are groups within chiropractic that want to move away from that and move more into more scientific literature of a spinal dysfunction, calling it that. I really don't have a concern which way, because what I do is find and fix, if by adjustments, as much as possible, things in the spine or joints, knees, ankles, shoulders, that are not in balance, that are being irritated by something that's not right. We often find that it is habitual things that people have done over a period of time that have moved them to a place where then they get a symptom. Now, I'm going to say a sentence that I will say to every patient. It has a lot in it, and I want to talk about that. Symptoms are the last thing to show up when you're already sick, and they're the first things to go away when you just start to get better. Now, there's a reason for that. I believe that we were created. I believe that there was a God that created us. I believe that there was great intelligence behind that. And we are given a gift of choice. That's part of our gift of creation, is we get to choose the habits that we get ourselves into or don't get ourselves into. We can have habits of eating poorly or not exercising or not drinking enough water. But our habits are actually what then ultimately create the state of health that we're in. And so many times people come in here and they have a symptom and they can't really explain. I don't know what happened. I just got up out of bed and the problem and the pain started, and it hasn't gone away for 5 days. I tried medication, it didn't work, or maybe saw another doctor that gave some medication, and they didn't feel like that was what they wanted. They wanted to find out what the cause is, and we don't accept. I say this all the time because it's true. We don't accept every patient for treatment, because not everything is something that I feel that I can help. And if it is, then obviously we accept them as a patient. So I had a couple of new patients, and both of them had spinal dysfunction or subluxation, misalignments in the spine that can be worked on by a spinal adjustment or a cervical or a shoulder adjustment. And that's bringing things back into balance. It's as simple as that. It's like if you've got a stone in your shoe, there's a couple of ways to take care of it. You can take the stone out of your shoe, which I think is the best way to do it, or you can put 5 pairs of socks on the side of the foot that hurts. Now you can cover up the pain with that, but then there's potential side effects because you might cut off the circulation a little bit. And if you step just right still, you still feel it. But for the most part, it's covered up unless you're jumping and you come down and there's that stone. It's common sense things that get us into health. And part of the biggest thing that is misunderstood by people that don't know what chiropractors do is they don't understand the adjustment, or they're scared of the adjustment. My gosh, I've been doing this for 39 years and there's nothing to be scared of. As other chiropractors do, we explain things before we do it. There's not a surprise, and the exam leads up to the logical conclusion that there's a problem there, because when we palpate it, when we move it a certain direction, it hurts that way. So logically, you would want to move and adjust it in a direction opposite of the pain. But it's so exciting for me to be able to take a person that maybe is even a little skeptical. I actually like patients that are skeptical first. It's so much easier to help them and to impress them because they're not expecting anything. I'm the last resort. Why is that? Last resort. Well, anyway, I love the adjustment. I tell people this. I say they're either going to feel one of three things. They're going to feel either some relief, maybe some muscle pulling, or maybe some soreness or tenderness after the adjustment. Probably less than 10% ever get sore, because before we adjust somebody, we do an exam. We figure out everything first. I do thermometer testing. We can see the shift of the temperature on one side of the spine. We do range of motion testing. Certainly, like I said, orthopedic neurological checks. But we see the integrity of the spine. I tell people this, that function follows form. I mean, if you are an athlete, you've been told by your coaches, get your form right before you do your exercise. It's important to have the right form. Well, I'm saying the structure of the spinal column is incredibly important, the way you hold yourself, the posture. But if there's a misalignment, if there's an irritation of the soft tissue around that spinal area, and it actually might even irritate a nerve or at least inflame the areas, there's probably less than 10% that are actually pinched nerves. That's kind of a misnomer in the literature. It's kind of a layman's term, or a slip disc. That's a layman's term. The disc doesn't actually slip. It's firmly attached to the top and the bottom above each vertebra. But whatever it takes to get people in here to educate them, I guess that works. I try to be very detailed. I'm admittedly a bit of a nerd or a geek. I like the word geek better, I guess. I'm detailed about the exam. I explain things first, and then the patient is pretty satisfied. They understand what I'm doing. There isn't any exam that I do that doesn't make sense. There's a reason for each one. I watch the way they walk. I notice whether the foot turns out on one side, because that tells me what's going on with the pelvis. We check leg length. So we get to the point where we get the adjustment. And I'll also tell a patient that the first thing we want to do is to try to get them out of pain. The next thing is to stabilize. And then the next thing is to strengthen. So there's different phases of care. You don't want to jump right into strengthening if things hurt. It's hard to exercise anyway, but it's really hard to exercise if you hurt. It's 8 minutes. I've been talking 8 minutes. Can you believe that? But I'm excited about what I get to do, and I love what I do. And if you have any questions and wonder if chiropractic care might be good for you, there really is no other way other than to go to the chiropractor and ask the questions and have a consultation. Most chiropractors, if you ask them, if you can come in and talk with them, you haven't decided to be a patient yet, they will talk with you. They'll talk to you on the phone, come into the office and do a consult. And if they find that it's not something they can help, they're going to refer you someplace else. But you got to ask a lot of questions. And obviously you want to find somebody that you trust. I know a lot of chiropractors, and I don't know anyone that is untrustworthy, especially if you sometimes trust comes from you not getting enough information, from not asking enough questions. You got to ask questions and find out if this particular recommended treatment is for you. So I'm going to let this go right now at about 10 minutes. And it's nice to chat with you. I will get back and talk with you again soon.